Are you worried about your baby's safety and unsure what to do in an emergency? Don't worry, we've got you covered. In this video, we'll share essential first aid tips every parent needs to know to handle common baby health issues effectively. By the end, you'll feel more prepared and confident in caring for your little one. Make sure to watch the full video and subscribe to our channel for more helpful parenting advice and updates. Let's get started. 1. Understanding baby's basic needs. Feeding your baby is one of the most important tasks as a parent. It's essential to understand when your baby is hungry and how to feed them properly. Babies often show signs when they're hungry, like rooting, turning their head toward your hand, sucking on their fingers, or becoming fussy. Knowing these signs helps you respond quickly, ensuring your baby gets the nourishment they need. Remember, feeding time is also a chance for bonding, so take it slow and enjoy the moment. Sleep is another crucial aspect of your baby's well-being. Babies need a lot of sleep, and setting up a safe sleep environment is key to keeping them healthy. Always place your baby on their back to sleep, and make sure the crib is free of soft bedding, pillows, or toys that could pose a suffocation risk. This helps reduce the risk of sudden infant death syndrome, SIDS, a rare but serious condition. In addition to feeding and sleep, understanding your baby's general needs helps you create a healthy routine. Paying attention to their cues and following safe practices ensures that your baby is well cared for and safe. 2. How to handle choking. Choking can be a frightening situation, especially with a baby. It's important to recognize the signs early so you can act quickly. If your baby is choking, they may have trouble breathing, and you might notice them coughing or wheezing. Their face might turn red or blue, and they may not be able to cry or make noise. If your baby is choking, stay calm and act fast. First, hold your baby face down along your forearm, supporting their head. Give 5 gentle but firm back blows between their shoulder blades, using the heel of your hand. If the object doesn't come out, turn your baby over and use 2 fingers to give 5 chest thrusts on the breastbone, just below the nipple line. Repeat these steps until the object is dislodged or help arrives. Always keep emergency numbers handy and seek medical attention immediately after any choking incident. 3. Treating minor cuts and scrapes. When your baby gets a minor cut or scrape, it's important to clean the wound right away to prevent infection. Start by gently rinsing the area with clean water. You can use a mild soap to help remove any dirt, but be sure to rinse thoroughly so no soap is left on the skin. Cleaning the wound carefully helps keep it free from germs and reduces the risk of infection, which is crucial for your baby's health. After cleaning, it's time to apply a bandage to protect the wound. Choose a small, sterile bandage that covers the cut or scrape completely. Place it gently over the wound, making sure it sticks well around the edges. The bandage helps keep out dirt and bacteria, allowing the skin to heal properly. It's also important to check the wound regularly and change the bandage if it gets dirty or wet. Keeping the wound clean and covered will help your baby heal quickly and comfortably. 4. Managing fever. Fever is a common sign that your baby's body is fighting an infection. It's important to know what a fever is and how to check your baby's temperature. A fever is when your baby's body temperature rises above the normal range, usually above 100.4 degrees Fahrenheit, 38 degrees Celsius. To check your baby's temperature, you can use a digital thermometer under their armpit or in their rectum for a more accurate reading. If your baby has a fever, there are simple steps you can take at home to help them feel better. One way is to give your baby a lukewarm bath, which can gently lower their body temperature. Make sure the water is not too cold, as that can cause shivering, which might raise their temperature. If your baby's fever is making them uncomfortable, you can also give them baby-safe fever-reducing medication, like acetaminophen, but only if your doctor advises it. Always follow the dosage instructions carefully to ensure your baby's safety. 5. Responding to allergic reactions. Allergic reactions in babies can be scary, so it's important to know the common signs. If your baby is having an allergic reaction, you might notice swelling, especially around the face or lips, a rash that can be red or bumpy, or difficulty breathing. These signs can appear quickly after your baby comes into contact with something they're allergic to, like certain foods, insect bites, or pollen. If you suspect your baby is having an allergic reaction, it's important to act fast. Having an antihistamine prescribed by your doctor on hand can help reduce the symptoms. Always follow your doctor's instructions on when and how to give the medicine to your baby. Antihistamines can help ease the swelling, rash, and discomfort. However, if your baby has trouble breathing, looks pale, or seems very weak, seek emergency help right away. It's crucial to get medical assistance immediately in severe cases, as some allergic reactions can be life-threatening. 6. Dealing with burns. Burns can happen easily, especially when babies touch something hot. It's important to know the difference between minor and severe burns. Minor burns usually cause redness and pain, but don't blister, while severe burns might blister, cause the skin to turn white or charred, and can be very painful. Severe burns need medical attention right away, but minor burns can often be treated at home. If your baby gets a minor burn, the first thing to do is cool the area with cool running water for about 10 to 15 minutes. This helps to reduce the heat and prevent the burn from getting worse. Avoid using ice, as it can damage the skin further. After cooling the burn, gently cover it with a clean, non-stick cloth or bandage to protect it from dirt and bacteria. This helps keep the area clean and reduces the risk of infection. Keep an eye on the burn as it heals, and if it doesn't start to improve or if you're worried, it's best to see a doctor. 7. Understanding poisoning risks. Poisoning is a serious risk for babies because they often explore by putting things in their mouths. Common household items that can be poisonous include cleaning products, medications, certain plants, and even some cosmetics. It's important to keep these items out of reach and in child-proof containers to keep your baby safe. If you think your baby has swallowed something harmful, it's important to act quickly. Do not try to make your baby vomit, as this can sometimes make things worse. Instead, stay calm and call emergency services or your local poison control center immediately. They can guide you on what to do next. While waiting for help, try to identify what your baby might have swallowed and have that information ready. Quick action and having the right information can make a big difference in keeping your baby safe from poisoning. 8. Knowing when to call for help. As a parent, you know your baby better than anyone. If something doesn't seem right, trust your instincts. Babies can't always tell us what's wrong, so it's important to pay attention to changes in their behavior, such as unusual crying, difficulty breathing, or a sudden rash. If you feel that something is off, it's always better to be cautious and seek help. It's also important to have emergency numbers handy, such as your pediatrician's office, poison control, and local emergency services. Keep these numbers in a place where you can easily find them, like on the fridge or saved in your phone. Remember, it's okay to call for help even if you're not sure it's an emergency. Medical professionals are there to assist you, and it's always better to be safe when it comes to your baby's health. Acting quickly can make all the difference in a serious situation. Thank you for watching. We hope these tips help you feel more confident in keeping your baby safe and healthy. If you found this video helpful, please give it a thumbs up. Don't forget to subscribe to our channel for more parenting tips and advice. We'd love to hear from you, so feel free to share your thoughts or ask any questions in the comments below. And if you think this video could help other parents, please share it with your friends and family. stay safe, and remember, you're doing a great job.